Kuni BMW salutes Oregon's champions.
Dr. Jonathan Hill. I work at Legacy Emanuel Hospital. When I started, trauma in general was an institution by institution patchwork system. At about that time, Dr. Bill Long and others began to develop a statewide trauma system, so that the idea behind a statewide trauma system was clearly to provide the best kind of trauma care to the citizens of Oregon in a very focused manner. When I became a cardiac surgeon, I really began to look at how one could apply cardiopulmonary bypass technology and use that and apply that to trauma situations. Well, I think that having the advent of trauma delivery systems, and among those delivery systems are things like the helicopter, like LifeFlight, that could really bring people from most of rural Oregon into a trauma center very quickly and very rapidly. It meant that it saved time, it saved people's lives. I think that by using that, we also were able to develop other systems as sort of extension, such as the concept of a mobile surgical transport team, where rural hospitals and small communities whose resources would be outstripped very quickly by serious trauma, the mobile surgical transport team could actually fly there and take blood, take nurses, take much needed support systems to help stabilize those patients and then bring them into a bigger trauma center that had the resources to deal with severely injured people. You're always looking how you can make the system better. I think that if you look at how can we make it better for the citizens of Oregon, I mean, that's really the goal. The goal is to improve not only day-to-day trauma care, but I think in looking at education of the public and all of those things that get people into the hospital to begin with, whether or not it's helmets for kids, whether or not it's drug education, since so many people who come into the trauma system are somehow impaired by either alcohol or other kinds of drugs. I think that looking how you can collaborate with other members of the medical community, whether or not it be the university or other hospitals or the areas of rural Oregon, and how to continue to improve on developing a trauma system for the state. Because ultimately that's the goal.
Kuni BMW salutes Oregon's champions.